Good morning, everyone. My name is Jason Leach. I'm the Operations Lieutenant for the Sioux Falls Police Department. We're here today to share a little bit about the co-responder program that we started in the summer of 2022 with Southeastern Behavioral Health. This is a program we ran last summer and again this summer. One of the things we want to talk about today is how that partnership with Southeastern Behavioral Health has really fostered this program, and from building it to where it's at today, and the impact it's had on our community and providing resources to specific population. The co-responder model, when we talk about that, that's putting a trained police officer with a mental health professional in a car together. They're out there together, riding in our marked patrol car. Our officer is in uniform. Officer Andrew Parrott's going to share a little bit more about that as we get through this briefing here. But they're riding together, they're responding to calls that are actively going on, acute calls for service. So it's not just doing follow-up, but they're responding to those 911 calls for people in mental health crisis. They can deploy out in that car, respond to that scene, and talk to those individuals, work to de-escalate situations. They're also called over by other officers to interact, to respond to those calls, and take over the calls. When we looked at this program, we did a lot of research and we did some training. We actually took trips to Wichita, Kansas, and to Tucson, Arizona to see their nationally recognized programs for co-responder. That really helped us mold and build our program to what it is today. Right now, currently, we operate this program over the summer months, and we utilize our school resource officers because the school is not in session, so we have resources available to run this program over the summer months. Again, we partner with Southeastern Behavioral Health to provide that mental health professional to respond with our officers. All of the Sioux Falls PD officers have de-escalation training, but right now we're sitting at 38% of our department that's trained in crisis intervention teams training. And all of our school resource officers have CIT training, and they also have CIT for youth training. So it's a great resource to utilize our school resource officers for this. Sharing some data, over the last 2 summers, we've treated and responded to 230 unique individuals in our community. Over half of those individuals were treated in place. So that means our officer and the mental health professional interacted with them, talked to them, and then decided that it was just safe and best for them to be left in place. And that's great. And that's what we're looking for, is somebody to come in, talk to individuals, and de-escalate that situation. And of those, over half were, like I said, treated in place, and 25% were set up with appointments with Southeastern Behavioral Health for follow-up. So great to see that partnership and furthering that resource. One of the other things we tracked was how many police units were we able to release from those calls. So obviously a 911 call comes in, our officers stop out at that call, they talk to the individual, and many times they were able to call the co-responder unit over. The co-responder unit was able to take over that call and release those units to go back out to taking active 911 calls for service. Over the course of the last 2 summers, we were able to free up 213 law enforcement patrol units to go out and take other calls for service. The co-responder unit could spend more time, dedicate more time to identifying the root issues with individuals and help them be successful. We also freed up 2 of our Sioux Falls Fire Rescue units to go on to back into service for other calls for emergencies, and 3 of our patient care EMS paramedic units freed them up as well. So this really just ensures that we can put our partners in public safety back in service as fast as possible. One of the last things I want to mention before I turn it over to the rest of our team is during our non-summer months, we still have our community resource officer program that does follow up with Southeastern Behavioral Health. They go out during the week, usually 1 day a week, and work with individuals in our community that just need some further connection with services. And so it's a partnership that we elaborate on and work with throughout the year, but over the summer months is when we run that co-responder unit. So I'm going to turn it over to Kim Hansen with Southeastern Behavioral Health, and she's the Director of Community Support Services.
Good morning. I'm Kim Hansen. I am with Southeastern Behavioral Healthcare. I am the Director of Community Support Services. We are thankful for the success that this innovative program has brought to our community and the partnership with the Sioux Falls Police Department. Partnerships like this with the Sioux Falls Police Department and other public safety entities ensure a closed loop of support services for people in our community struggling with their health, whether it be mental health, substance use, poverty, or other adversities. Our staff who participate in the ride-along co-responder model are highly trained mental health professionals who specialize in crisis de-escalation and community resource savvy. They are case managers with access to resources to utilize with most any situation they may encounter. We monitor our teams to identify staff who have special abilities and excel in crisis de-escalation and understand the psychological impacts of trauma on human behavior. These are professionals who are great listeners, passionate about making a difference, and want to go out into the community and do this very important work. The co-responder teams respond to active calls, but are also able to patrol town and check in with individuals who may need follow-up from previous interactions or incidents, or anyone who may appear to need assistance in some capacity. This partnership is a benefit to the community as a whole. The more that we see early intervention and crisis de-escalation and connect people to care, the more we can hope for expedited recovery and the most efficient use of resources from both the public and private sector. By locking arms with the Sioux Falls Police Department, we are helping to connect people who may not know where to go for help to get the resources they need, ensuring no one falls through the cracks. We are thankful to be able to share the co-responder program with you today, and now I will turn it over to Officer Parrott to share some of his personal experiences and the human impact this program is having on our community.
Well, good morning. My name is Andrew Parrott. I'm one of the school resource officers for Sioux Falls. So over the past 2 summers, I've had the opportunity to work with the co-responder model when school is off. And I kind of want to share just a couple brief stories of my take on some of the successes we've had. One of my favorite stories was we were in the downtown area, Kim and I, and there was an individual. He had a piece of cardboard. I think it said, "Anything helps," or something to that effect. I don't remember exactly what it said. We went down and met with him just to see if there's anything from a police officer's standpoint or from Southeastern standpoint that we could do to help this individual. By the time we were done, there was a line of 4 to 5 people behind us. And he kept introducing us as, "Hey, this is the car that helps people." So then all of his friends would kind of get in line. They'd wait their turn to speak with Kim and Southeastern Behavioral Health to see what they could offer. So it's one of those feel-good moments of the guy was actually very appreciative of the help we were able to give him. One of the other stories I want to share with you is we had an individual that had called 911. She was kind of in a crisis, having some mental health issues. The officer on scene identified that probably the best route for this individual was the co-responder. So that officer had sent me an email, reached out, said, "Hey, I met with so-and-so," kind of gave me some quick backstory on it. Would you guys be willing to meet with her? We ended up meeting with this individual, got her set up with Southeastern Behavioral. They're doing case management, they're doing therapy, and is kind of getting her in a better spot. So the big thing with policing for us is policing is a lot of in the now. You're going to a call, you're going to try to as quickly and efficiently solve that call because you have so many more stacking up you can go to. With the co-responder model, we're able to spend more time with them and offer more resources. So it's just a great tool for us to use for the city to help benefit the city. So that's one of the other nice things with the Sioux Falls Police Department is we have so many other programs in there. So it's not, everything you see on TV with policing or in movies. We have different avenues we can use to help people. And a lot of these people we deal with, they are, in some sort of crisis or kind of maybe in a low in their life, and we're able to offer support for them to kind of get them back to a better spot. And just like the lieutenant said, we're able to look more at the root cause instead of, hey, here's a quick Band-Aid we put on this, we go on to the next call. We can actually help with the root cause of this and get them to a better place in society. So that's very brief, but just my quick interactions with the co-responder model. Any questions you guys may have for me or any member of the panel?
So for these types of calls that you guys need to monitor, whether is it maybe an officer goes who senses it and provides that, you guys think the best option?
So a combination of both. We'll get emails from other officers identifying people they dealt with and say, hey, I had this interaction. Is this someone you guys could follow up with? We would have calls that be calls for 911, someone in a mental health crisis. We would go to those. We'd also have our officers call us, say, hey, I'm out on this call. This might be something you can benefit. Can you come out and help us? So we had a really great combination with all of that, and a lot of it was due to my patrol officers helping out that way, which is awesome.
You see a lot of the same folks over and over, not necessarily services, but over and over on the streets and all that. Give me some sense of the scale of the numbers of people that you have on daily.
So just how many interactions we're having a day, or?
How many people are out there that need help on the street?
Quite a few. You got a guess on a number there, Lieutenant?
Yeah, I guess I don't have the question was how many people are we working with on a daily basis or seeing repeatedly? When we looked at our numbers, there are unique individuals in our community that are using more services or requesting are called for more services, and that's really where dividing the time or spending the time, the co-responder model can spend that time and really dive into the issue at hand and really try and help somebody, whether that's maybe a better connection or reconnection with Southeastern Behavioral Health or a different entity within our community. But the nice thing is, when we look at resources, this individual might have, let's say they missed an appointment with their counselor or their therapist. Southeastern Behavioral Health would know that. We wouldn't know that as a police officer, but now that partnership we have here brings that all together so we can say, hey, you know what? Hey, sir, we missed your appointment last week with your counselor. Can we help get you over there for your appointment right now? So we were doing things like that. I guess I don't have an exact number for people. Like I said, we assisted with 230 calls over the last 2 summers. So they were quite busy. And the nice thing was they were able to spend that time and devote that time because they weren't waiting for that. All their officers are out there. There's more 911 calls waiting. There's more emergent calls going on. And so these officers had time to spend and really dive into the issue at hand. So.
I have this sense in my brain that it's gone down, but that's probably not true.
Yeah, I mean, mental health crises can happen anywhere, and so we focused a lot in the downtown area, but also could respond to anywhere in the city. So yeah, they were all over the city, but I think predominantly in the downtown area. Correct. So we have one co-responder that when we ran it during the summer months, again, last summer was a pilot project, so we ran Monday through Friday during business hours, and we ran one officer, one mental health professional out in the car together, and we ran Monday through Friday that 8 to 5 time. And so when we looked at this summer, we had to look at staffing and working with different entities. And so we decided to run the program the same, but the Sioux Falls Police Department devoted 2 officers to the program this year. And so when we had everybody working, we had Andrew and Kim, let's say, out in a car together, and we had our other officer that was dedicated to looking, identifying calls for service that maybe they could respond to, or maybe they could do follow-up and call the co-responder over. Once they found somebody or located somebody, they could call them over and have them take over the call from there. So we actually devoted 2 officers for this summer, and next summer we're going to do the same dedication there. So. Yes, the question is, are officers uniformed when they're out in patrol for this? Yes, we're doing that. Some departments go to a softer uniform where they're wearing khakis and a polo. Really, we've stood out that we are the police department, so we identify that we are in uniform. But the nice thing is, like Andrew has told me several stories, he'll approach the scene talk to an individual, but a lot of times can turn it right over to our mental health professional, and then the person's more at ease to talk to this individual that's not in a uniform, not wearing a vest, not wearing a gun, and he just stands back to make sure they're safe, and then they can have a safe interaction. So that's really the best part for us, is that partnership.
After 2 summers of this, do you see like how you may want to grow or continue to do this?
Yeah, so staffing always becomes a question when you're looking at starting a new program. And so we have our school resource officers available during the summer months, and so we've really dedicated the time to that. But then what we're doing is identifying when there's a school break, like if there's no school on a Friday or a Monday or something like that, can Southeastern support it? Last year, I think you guys did 4 or 5 days over Christmas break. So they took some time over Christmas break when the school wasn't in session, when obviously there's sometimes more mental health crisis going on or behavioral health crisis going on during the holiday season, and we devoted those resources out to it at that time. So we're identifying where we can. Would we love to get to the point where we have enough staffing to be able to dedicate for both of our agencies to having this full time? That would be great. It might take some time to build there, though. Any other questions?
Just along that line, do you have an estimate of what it would cost to have a full-time presence?
Yeah, I guess I don't have an estimated cost at that point right now. Right now, we're still actively recruiting police officers, and the more that we can build our police force and get to that, attain that goal of our authorized strength, that will get us to that point where we can bring on additional resources and do that. And it won't be a cost, because we're striving to get to that number of our authorized strength right now. And once we get there, that's when we'll be able to devote those resources. So it'll already be something it won't cost our department any extra, because we're already have the individuals hired and they'll be at the police department. Now, when we talk about Southeastern Behavioral Health, I don't know how much it would be for them. We have a good partnership together right now, and they're providing those services. So the city's not paying for their services. They're stepping up to the game and providing those services. So. Yeah, Southeastern is donating their staff time to this project, so that's how important it is to our community. So, anything else we can help you with or answer for you? Thank you all for joining us today. Appreciate it.